So, are you or someone in your family living with a constant hip pain? Do the daily tasks like walking, bending forwards, tying the shoelace, getting in or out of the car, sleeping is difficult and painful? You might have heard the term total hip replacement surgery, but you are unsure when it is the right time to do so. So in this video, let's discuss about when you should seriously consider the total hip replacement in a very simple and clear fashion. Namaskar, I am Dr. Prasun Sanyal, consultant arthroplasty surgeon. So first, let's understand what hip replacement surgery actually means. In this surgery, the damaged part of your hip joint, which is the ball in the socket, it is replaced with an artificial component which is made of high-end metals, ceramic or polyethylene. This helps to restore the smooth movement and reduces the pain. But hip replacement surgery is not done for all cases. It is usually suggested when all conservative treatment modalities like painkiller medications, physiotherapy or other management, they are exhausted. So, when should you consider hip replacement? Before going to that, you need to understand what are the common causes of hip replacement surgery. The most common cause is avascular necrosis of the femoral head, where the femoral head blood supply gets damaged. The second one of the common causes is hip arthritis, which can be from primary osteoarthritis or rheumatoid arthritis. A third, a very common cause is post-traumatic, where there is a fracture of the neck of the femur or in rare cases fracture of the acetabulum. Rarely, hip arthroplasty is also required in inflammatory arthritis of the hip like ankylosing spondylitis, and the most difficult of the primary cases, the developmental dysplasia of hip. So what are the warning signs? If you have severe pain in your hip joint which is persisting and it is present in the wrist, if the pain makes it difficult or hard to walk normally, climb stairs or do daily activities like tying your shoelace, going in or out of the car or using the toilet. If you feel stiffness or very restricted movement in your hip which affects your own gait or independence. If your hip pain is affecting your sleep, mood or mental health, or if it is impacting your overall social well-being, then this is a strong sign that you should consider total hip replacement. The orthopedician or the arthroplasty surgeon, they usually try non-surgical options like analgesics, painkillers, physiotherapy, weight loss or other maneuvers. But if these maneuvers or these measures, they exhaust and it does not bring any significant reduction of your pain, then total hip arthroplasty may be the only long-term and durable solution. Modern hip replacement surgeries are much safer with a faster recovery and long-lasting implant survivorship. And one more thing, you don't have to wait till you are very old to have this surgery. Many people think hip replacement is only reserved for the elderly, but that's absolutely false. It's not about your age, it's about the condition of your joint. Many people in their 30s, 40s or 50s undergo successful hip replacement surgery. They return to their active, pain-free life. Remember, the most active phase of your life is not beyond the 60s. It is the early 30s, 40s or 50s. So, if you are suffering from pain or restricted life movements in your early phases of life, don't hesitate to go for the surgery. So, if you or someone in your family is struggling with a chronic and long-term hip pain, it is time to consult a arthroplasty surgeon or a orthopedic specialist. They will clinically evaluate, will do X-rays or MRIs, and they will decide whether the surgery is required or not. So remember, you should always consider hip replacement when the pain is affecting your daily life and independence, and all the non-surgical treatment modalities have been exhausted. It is not just about getting rid of the pain, it is about getting your life back. So, if this video helped you to understand when to consider hip replacement surgery, don't forget to stay tuned and being connected with us. Thank you.